Hello friends, on this video today we're going to talk about how to treat hyperpigmentation. So if that's an interest to you, please stay tuned. If you are new here, I'm Winnie Mans and you are most welcome. And if you've been here before, thank you so much for stopping by again and you are welcome. So let's dive right into it. So let's start first by knowing what is hyperpigmentation. Hyperpigmentation simply are all those dark marks on the skin. So buddy, before we go into how to treat the hyperpigmentation, let's get to know first what causes this hyperpigmentation on our skin. What causes all that? So number one factor that causes hyperpigmentation is acne. Acne causes inflammation, and an inflammation, it stimulates the melanocyte cells to produce more melanin, which ends up causing the hyperpigmentation on our skin. Factor number two is hormonal imbalance. Things like family planning pills can cause hormonal imbalance, which might end up causing hyperpigmentation on our skin. Now also pregnancy can lead to hyperpigmentation due to hormonal imbalance. So you might end up maybe during dark circles on the eye, the mouth area, neck area, things like that. So all those are hyperpigmentation. Number three factor for hyperpigmentation is UV rays. UV rays, they stimulate the melanocyte cells also to produce more melanin, which leads to hyperpigmentation on the skin. So those are the major three factors that causes hyperpigmentation. So since we've known what causes the hyperpigmentation, let's get into how to treat hyperpigmentation. You can use creams such as hydroquinone. It's the most powerful cream out there for tackling hyperpigmentation, but it has quite some side effect to it, and most especially on dark skin or black skin. So you need to be very vigilant, because like on dark skin it causes things like ochronosis. Ochronosis is just a situation whereby the skin gets even more darker than it was before due to the reaction from hydroquinone. So that's one. Number two, also hydroquinone can cause risks of getting cancer later if used for a long period of time. Number three, it causes something known as a rebound hyperpigmentation, in that, let's say you are using hydroquinone, then you stop using it for some time. You'll get hyperpigmentation on your skin again, simply because you've stopped using the hydroquinone cream that you've been using for some time. Then another thing, there are those who can end up being resistant to it, like it won't irritate your skin, and after you've used it for a long time, that's when you can't stop, because the moment you stop, you get a rebound hyperpigmentation. It's called a rebound hyperpigmentation, whereby the hyperpigmentation comes more darker marks than it was before, the moment you stop using the hydroquinone cream. Second treatment for hyperpigmentation, you can use kojic acid. Kojic acid is the same as niacinamide, and it's mostly used on high-end skincare products. So it can also be quite irritant to skin. So if it doesn't react to your skin, you can use it to treat your hyperpigmentation. And if in case you apply and then you feel like that tingling sensation on your skin, you should stop using it at all, because at the end of the day you're just adding more problems, because that tingling sensation means it's irritating to your skin, and that means you should stop using it. If you don't, it will cause more harm than good, and we are just trying to deal with the hyperpigmentation. So any product that irritates your skin, you'd rather stop using it immediately, rather than if you assume and you continue, you keep using it, it will cause even more more damages that might end up also causing more hyperpigmentation that you are trying to eradicate or you're trying to deal with at the moment. So be very vigilant and listen to your skin. Third one that can help you treat hyperpigmentation is azelaic acid. azelaic acid, it's effective as from 4% and above. Then the good thing with azelaic acid, it is it has low allergen rates in it, so it's safe to use because it's non-irritant to skin. Fourth one, vitamin C. So vitamin C is just, it's the same as ascorbic acid. And ascorbic acid, there are two types of ascorbic acid. There is L-ascorbic acid and D-ascorbic acid. And when it comes to treating hyperpigmentation, you want to go for L-ascorbic acid because that's the one that will tackle the hyperpigmentation. Another one is alpha-arbutin. Alpha-arbutin is the safe derivative of hydroquinone. So it's much safer compared to hydroquinone and less irritant to skin and even less side effects to it. So it's so good to use instead of hydroquinone. Yes, friends, so the sixth one is alpha hydroxy acid. These are just the chemical exfoliants. You know, before, okay, not even before, they are still in the market, because they are still in the market. There are those the facial scrubs that you have to rub on your hand. You wet your face, then you rub them on your hand, and then you apply on your face. That's how you'll have to, that's the process it will exfoliate your skin. So these chemical exfoliants are those that you just apply on your skin and you let it sit on the skin. And they are such as the lactic, mandelic acid, and glycolic acid. Yes. So those are the chemical exfoliants, and they are there are a variety of brands out there that you can use. Exfoliating, simply, it will just fasten the process of you treating your hyperpigmentation, since it's going to remove the dead skin, and that will enable the penetration of those products you're trying to apply on your skin much faster. So it makes the absorption of those products into your skin much faster compared to when you're just maybe applying those products and yet you don't exfoliate. So exfoliating just fastens the process by enabling the products to penetrate faster. Another thing also, you find in some people that hyperpigmentation is just on the top layer of the skin. So the moment you exfoliate your skin also, you've got rid of that dark spot or those dark marks, revealing the inner layer of the skin, which is more softer and which will penetrate, the product will penetrate through very faster, and you'll see faster results. Yeah, you'll see quicker results. And the last one, friend, you can also use retinoids, because they're also used as skin lightening, so they can also help you tackle the hyperpigmentation. And note these products, like all the azelaic acid, mandelic, azelaic acid, kojic acid, the vitamin C's, all those creams, all those serums, they are very effective, yes, but they take longer compared to hydroquinone. Then they take longer for you to see results, so you need to be very patient with them. It will take, because it will take around 2 months or so for you to start even seeing some results. So you got to be patient. You got to be patient while using those serums, because our skin, like that, as we had talked on the previous video on how to apply your serums, your skin takes, the more you age, the more your skin takes long to rejuvenate. Rejuvenate simply means like to exfoliate itself and to bring the inner layer. So it takes like around, the more you age, when we are young, it takes like 6 to 8 weeks. But the more you grow, it continues, the process takes a bit longer, like 10 weeks, or even like 12 weeks, 13 weeks. So it depends also with your age. So you need to be patient with all these products while using them for you to see the results. So yeah, then they'll take like a minimum of 2 months for you to start seeing results, but they are much safer compared to hydroquinone. So you have to just practice patience, bestie. You just have to practice patience. So those are the major products you can use to treat your acne. And this is the end of our video. If you've reached this far, please don't forget to at least subscribe, bestie. Subscribe for me, support me, and let's get to work on our skin so that we have a healthy, glowing skin. Understand? Thank you so much for watching, and see you sooner than later. Bye.